Good evening. Welcome to Feet Forward with the Illinois Podiatric Medical Association. Welcome to our show. This is our May show, and of course, with May, we're getting into a better weather season. So we're going to talk about some injuries that are common, things like ankle sprains, ligament injuries, tendon injuries from athletic activities, sports, working out, weekend warriors. And with us is Naperville and Chicago podiatrist Larry Kosova. Welcome.
Hi, how are you?
Good to have you. Before we get into the meat and potatoes of the show, we're going to try a new wrinkle here on Feed Forward because we're pretty much pioneers here. We are, let's face it. We're going to ask a true-false question on the air. And for any caller that calls in with the answer, we will give away an IPMA pedometer and walking kit. Now, Larry, you probably might say, why are we giving away pedometers? Well, starting later this month and next month, the Illinois Podiatric Medical Association is going to start its walking campaign where we encourage people in Illinois and Chicago to take up a walking campaign as a sign of fitness, to reduce obesity, to get people moving, and to do our share for the public health and make a difference in society. As we all know, obesity is a big problem, and most people can walk. And walking is an accessible exercise. It's very easy to do. It can be done in all sorts of weathers, climates, and geographies and neighborhoods. And Chicago is a big walking city, so we think it's very apropos for us. So the true-false question is, and this is going to be very germane to our topic today, so bear with me. A common question that people ask podiatrists is, if you have a foot or ankle injury, it's okay to soak it in hot water immediately. Is that true or false? I'll read that again. If you have a foot or ankle injury, soak it in hot water immediately. True or false? So anybody that calls in with the correct answer, we'll take down their name and address and we'll ship you out a free pedometer. All right? So let's dive into our topic now. As we mentioned in the introduction, we're talking about ankle sprains, tendon injuries, and ligaments. So let's start with ankle sprains because that's something that I think we can all relate to, whether you're playing basketball and you come down on someone's ankle and you hear this sort of shredding in your ankle. Everybody's gone through that. To some of the more obscure injuries that people may not be as familiar with. So why don't you start? You've got this great foot model. I want you to hold it up so everyone can see it. And talk a little bit about an ankle sprain. What actually is a sprain, first of all?
You know, it's funny because people have different variations and different opinions of what actually a sprain is. The most common thing is that we see people coming to the office for is that they'll say they were running down the block or they tripped over a hole, they tripped over a kid's toy, and they have a twisting of their ankle. And sometimes we'll ask patients, well, you know, have you sprained this before? And they'll say no. But then I'll ask them another question, well, does your ankle give out? And they'll say yes. It gives out 3 to 4 times a day, which is never a good idea.
Well, so let me stop you there. What does give out mean? And how is that different than a sprain?
It's virtually the same thing.
It is.
And we'll get into that a little bit later, why somebody will say it gives out versus I just sprained it. But typically you have 3 ligaments in the ankle. I'm going to call them ligament number 1, ligament number 2, and ligament number 3. They actually have long Latin medical names, and for my patients, they don't want to hear anterior talofibular ligament, so it's ligament number 1.
Right.
And the one thing that people nowadays should really understand is that any time that you sprain an ankle, you're actually twisting the ligament and tearing it a little bit, and that's why sometimes you see some swelling around the area. You might see it a little black and blue around the area. And you know, some people will have pain and some children don't have pain around the area, but it tends to be swollen over this area. And then you have ligament number 2, that this would be, ligament number 1 would be your stronger ligament. In fact, it's the strongest of the 3. So, you know, when you hear people having ligament sprains, and I have a gymnast now that actually sprains her ankle, you know, 3 to 4 times a month, what she's doing, she's stretching that ligament, and it never comes all the way back in. And then she goes to stretch it again, and it stays in that position. So if you can actually imagine you're taking a ligament, and you're stretching it. This is the ankle, and you're stretching it, and then it heals in this position. And then she does it again and again, and then it tears.
And what happens over time with something like that? So a gymnast will be competitive for 5 or 10 years, and this will happen all the time. When that person gets older, what's going to happen to that tendon and that ankle when they're 35, 45, 55?
Well, the potential for it to basically keep giving out, again, having that person that says, my ankle gives out, and it gives out often. They might be running upstairs to answer the telephone, and all of a sudden their ankle gives out. And the potential why it's so bad for somebody is that you have this big bone here called the fibula. And if these ligaments start to tear, the next thing that takes up the trauma is this bone. So patients can actually get bone fractures from not taking care of simple sprains, in this case when they were younger, or just throughout basically their lifetime. So, in our practice, we take ankle sprains rather seriously, treat them pretty aggressively. A lot of times the typical scenario is that somebody would sprain their ankle. They would go to either an emergency room or an urgent care center down the block or in their community. And a lot of times they're just given a shoe to walk in, told to go see somebody if it hurts. And, 80% of those patients don't really follow up with their doctor or don't follow up with a podiatrist. And then what happens is that problem gets worse. They go back into gym or they go to work and they're standing on it and they're doing activity on it. And then, it just never gets worse. The ligaments start to thicken up and then they re-injure it again. And usually it's that second or third injury where it becomes really severe that ligament that's just stretched can actually tear. And we call that a rupture. So we want to try to prevent those types of situations.
Now, we have a quick acronym that a lot of you have probably heard about before. We're going to put it up on the overhead here. It's called the RICE method, and that stands for rest, ice, compress, and elevate. And why don't you take us through each of those steps and what that really means when you're talking about rest in terms of an ankle sprain, okay?
Yes, well, this is really one of the number one things that we try to tell our patients. Is resting is basically getting the foot up on a couple pillows, and just really getting off of it, any type of rest. In our patients' population, in my practice, we actually wrap the foot in something called a soft cast to take some pressure off of it.
Great. Well, we have our first caller. Welcome to Feet Forward.
Hello. Good evening, gentlemen. I have a question. My mother was diagnosed with multiple sclerosis a while back, and she has dropped foot. And I'm wanting to find some more information about this new WalkFit electronic stimulator. It's sort of expensive, but I was concerned about, the deterioration around the myelin sheet that's as a result of MS, and how would this electronic shock, and does this expensive sort of WalkFit electronic stimulator, does it really help with dropped foot and making people who suffer walk better?
That's a little bit interesting. It's a little bit off topic, but I will take it. I'm not sure about the WalkFit stimulator exactly, but electrical stimulators to muscles to get them to fire can actually help. And with multiple sclerosis and other degenerative diseases of the muscle and tendon, you can actually see some benefit with drop foot with that. Now, the question is, I'm assuming that your mom has seen a neurologist and is following up with somebody. You would have to really see how bad that degeneration is to see what effect you would actually get with the WalkFit electrical stimulator.
Okay, so my question really, as it relates to the WalkFit, was that is it possible that something could externally or internally stimulate the foot based on the mechanics of it, and actually at some point lead to a foot sort of getting back to being operational?
Well, it depends on the variety of drop foot that your mother has, which, of course, on today we won't really know that. If it's severe drop foot, it might not improve it as much. A lot of times with a moderate to severe drop foot, there are things you can do surgical to actually transfer the tendon to bring up the foot and then use electrical stimulator to actually help her walk further. But I think, the best thing that you could do is you have the number behind us right here, 888-869-3338. And give them a call, find somebody in your area that has expertise in this area, and get an evaluation and to see if this is something that's actually viable for your mother. And good luck to you.
Thank you for your call. All right, that was an interesting call. Before we get back to the ankle sprain and the Rice method, give us a quickie definition of what drop foot is. That's a new term that a lot of people may be unfamiliar with.
Yeah, drop foot is a condition. It's a neuromuscular condition. I could actually use the foot here, that for whatever reasons, whether it's trauma or neurological problems, is that the foot literally drops. So the term drop foot is pretty apropos. Mm-hmm. And the tendons on the top just don't function the way that they should. So the tendons on the back, if you think of rubber bands, the rubber bands on the back and on the bottom overfire, and the ones on the top don't work. Mm-hmm. So what I was trying to tell this caller is that you can take tendons on the side and on the back, put them to the top to actually bring the foot up, and then use electrical stimulator to help fire that. But again, that's something that is different for everyone.
Great. Okay, that's an interesting call. So let's go back real quick to our acronym, the Rice method, and I think you were getting through the rest and elevate, basically in the same sort of concept.
Yeah.
So I'm going to kind of go back over that real quickly. You were going to talk about ice, I believe, right?
Yeah, I mean, all our patients, basically, we wrap them in something to get rid of the swelling, and then we have them go home and actually apply ice. I tend to get kind of aggressive with this. I like ice 20 minutes every 2 hours on the part that's hurting, in this case the ankle. It could be a tendon or a ligament, which we will get into a little bit later, to reduce the inflammation. It actually helps with pain control also. Mm-hmm. Compression, again, I'm wrapping the foot, like I said, with a soft cast. A lot of people can use an ace bandage at home. And then elevations, what we were talking about before, of just getting it up on the pillow. You don't really have to raise it above the heart. A lot of people say, that's the thing to do, and that might be the best way. Mm-hmm. But even sitting in a chair, getting your foot all the way up, icing it, and having an ace wrap around it is really doing the majority to help reduce the inflammation and pain and actually to speed healing.
Mm-hmm. So for all our Feed Forward viewers out there who are paying attention, we'll go over that question again for the free pedometers.
I think an answer was given.
If you have a foot or ankle injury, soak it in hot water immediately. True or false? We still are taking your calls. If you want to call in, we'll take your answer and your name and address, and we'll ship you out a free pedometer with a walking kit for you. All right. So talk a little bit more about ice, because that's an often overlooked anesthetic. How does that work on the swelling of the foot that's so common for these sprains like that?
Well, what ice does is basically constrict blood vessels and reduces the inflammation to the area. And if you think of a car tire, in the summer the car tire expands. So if we put heat on something, it's actually going to expand it, and in this case, make it worse. Mm-hmm. In the winter, the car tire constricts and basically reduces its size, and that's what we're trying to do with ice. We're trying to reduce the part that's hurt, whether a tendon or ligament, in this case, an ankle sprain. So if you're listening for that correct answer, ice is really a key thing to do with almost any injury. And we tell this to parents all the time, especially with their children playing football, soccer, baseball. Get some ice on this thing first. Ice it for 3 to 4 days straight. Take an anti-inflammatory if it's really bothering you. And at that point, after 3 or 4 days, if you're still in pain or your child's in pain, the number's behind us to give them a call, to find a podiatrist in your area to treat you.
Right. So you had mentioned ligaments, and you pointed out 3 ligaments that are key to the ankle area and that are often affected by ankle sprains. But talk a little bit about the difference between tendons and ligaments, because they sound like they're similar things, but I know they're not. So I think there's important distinctions that our viewers would like to hear about. So why don't you take us through that too?
Well, a ligament is basically any soft tissue structure that goes from a bone to a bone and connects it around a joint. A tendon comes from the muscle up the leg in this case and comes down and actually forms the tendon to attach to a bone for function. So the tendon gives us function where the ligament gives us stability. So if we had a tendon on the top of the foot and it fired, it might bring the foot up. Where a ligament around an ankle joint would just stabilize that ankle and basically make it a little bit more secure. So the tendon is really function. So anytime in my case, I'm moving my hands now, I'm flexing my tendons back and forth. But the ligaments are basically holding the joints together.
I see. Okay. And do you see different kinds of injuries for each type of a tendon or ligaments?
In reality, a lot of the injuries that I deal with are overuse injuries. My practice does a lot of sports medicine, and whether it's a ligament, a muscle, a tendon, I see a lot of these overuse injuries, and the treatment is almost identical. Is this RICE treatment that you're suggesting, is the RICE ice compression and elevation to decrease that inflammation, to actually start the healing process to start. If you continue to walk on a part that's injured, or if you put heat on it and continue to walk on it, basically what you're doing is making that condition more inflamed and actually making it worse. And a lot of patients will tell us, I constantly put heat on this and it makes it worse, and I'm in more pain.
Right. What about bandaging? A lot of people might be confused about bandaging and how to do it, when to do it for an injury like this. What's your advice typically for patients with injuries kind of like this?
Well, if you're doing it at home before seeing a doctor, you could take an ACE wrap, which is that elastic wrap that you could buy at some of the drugstores around town.
Right.
And you want to start, and we're going to take a foot, for example, and you're going to start at the tip by the toe, and you're going to wrap it about 1/4 all the way up basically past the injured part. So if it's an ankle injury, I'm going to start here to push the swelling out and up the leg. If it's a higher injury, we're going to go above that area, again, wrapping about 1/4 around that. And that helps to basically immobilize the area because we don't want a lot of movement. We want this to heal. And once you get ice on that, and again, elevate it, you're starting that healing process and stopping it from basically re-injuring itself.
So do you bandage that during ice or afterwards, or what's the juxtaposition there?
The way that we do in our office is that we put a soft cast on, which is very similar to thick ACE bandage, and we have the patients go home and actually ice over these injuries. So I would put the wrap on first, and now you have something that you could put the ice onto. An important point is you don't ever want to put ice directly on the skin. So either use paper toweling, a washcloth, or in this case, you can actually use the elastic bandage and actually put the ice on. We don't want to cause another injury, a frostbite, due to over-icing these areas. You don't want to have ice for more than 20 minutes. If you keep it on for more than 20 minutes, you're actually creating heat, which is as bad as putting heat on something to make the injury.
Did you say 20 minutes for every 2 hours and then back on again?
Every 2 hours, 20 minutes. So at 2, 4, and 6, you'd put ice on for 20 minutes.
And that typically will reduce the swelling?
Over time, that will help reduce the swelling. Okay. We tend to have our patients do that for at least 3 to 4 days. Even if they're injured, we want to go past that injury period to actually reduce the inflammation, again, to speed the healing.
And even if your ice maker isn't working, or you don't have an ice machine in your fridge, frozen vegetables work pretty well, don't they?
We hear this all day long. For some reason, corns and peas tends to be the most popular because I think it's the easiest thing to cook after it thaws out. But it works. It works fine.
Yeah, I don't like to eat those vegetables after they've been used on feet, but that's just me. I'm kind of crazy that way. So let's talk about an athlete that may not follow the preventive or early intervention guidelines and exacerbates or makes the injury worse. What is that athlete looking at in terms of treatments, interventions, and surgeries for an ankle sprain or a ligament or tendon injury?
Well, it's funny that you said that because a lot of athletes are paid a lot of money to perform. And there's a lot of athletes that actually perform hurt. When Joakim Noah actually hurt his plantar fascia, I was actually called by the Chicago Tribune and interviewed, wondering why he was still playing and they weren't getting him out basically of the game, and why it's taking so long. So, the issue is with an athlete, they're a little bit better constructed as far as their ability to endure an injury. And unfortunately, a lot of times when they do endure an injury, they don't want to come out of the game. There's a lot of incentive, and some of this is monetary.
Right.
Their agents don't want them out.
Right.
But the treatment is really the same. I mean, they're getting them back in the locker room. And with most professional athletes with an injury, they're being taped between their whether innings or quarters or what have you. Ice is being applied. If you ever watch a professional basketball game and look at the sidelines, you'll see somebody with ice on an elbow, on a knee, on something. To get this thing iced down, wherever the injury is really important to, again, so you don't have that swelling, so you can actually go and actually perform. Treatments are really basically the same. It's just that they're conditioned at such a higher level than the average person, possibly both of us, compared to a professional baseball player or hockey player, that their injuries don't usually become that severe. But when they do, the treatment is virtually the same. And they would do a RICE treatment, the rest ice compression elevation, to some degree.
Right.
What you notice with pro athletes is that they get an MRI basically within 10 minutes of their injury to evaluate it, to see if it's a little bit more serious. And you hear very few of them actually having surgery, especially in season. But there's a couple of people that will have surgery out of season to improve on their condition.
Do you perform surgeries yourself on some of these patients that their injuries become acute?
Yeah, I mean, last week we had about 3 to 4 ankle surgeries that we actually performed, actually all on young athletes, ages 13 to 18, because they had these high-level ankle sprains that actually went on to rupture, and we actually had to repair the ligaments so they could get back to their activity level. So that's what I do for a living, tendon ligament reconstruction and ankle reconstruction. And it's unfortunate, but it does happen.
What is that surgery like? Take us through, if you can, with the model, how you reconstruct a tendon or ligament.
Well, it's kind of hard with the model because we can't really see the ligament here, but there's many different ways that you can do it. And if you think of a ligament as a rubber band going up and down here, and it basically tears. And if it tears, you have to do something to actually repair it back. So if you think of thread and like almost doing a hem on a skirt or on a pair of pants, and we're actually taking the pieces and more or less putting them back together. You have to make an incision and go through and actually do that to the ligaments. And if there's 2 ligaments, you're doing it to either one. There's different ways of doing it, and there's different techniques that they call them. But basically repairing them back, putting sutures through. Most of these patients are in a cast between 4 and 6 weeks, non-weight bearing, in other words, using crutches, staying off of it, and then approximately 2 to 3 months of physical therapy to get them back to their athletic ability.
And that's for an athlete who has a more aggressive timetable, too. They want to get back by the end of the season or something like that. For an average Joe like you and me, we have a more generous time frame. We don't necessarily need to be back on the field, so to speak, that quickly, right? So we can be a little less aggressive.
Well, one of the things that we start doing is we can cast the patient first and seeing if that injury actually repairs and gets better. But a lot of times that we're seeing that casting alone, especially for a ligament or tendon injury, isn't really sufficient. In fact, a lot of the patients that are referred to us have been casted prior, or they've gone to other doctors for conservative treatment that just didn't work. And that's where some of these other modalities, whether conservative or surgical, actually will get the patient better.
We've only got about a minute left in the show. Are there any preventive tips you can pass on to the viewers to help them reduce the chances of an ankle sprain or a tendon or ligament injury? Or is it just, if you're going to play baseball or soccer, these are kind of inevitable.
No, I mean, really, we go through strengthening exercises with the patients before their activity, and I'm really into stretching and strengthening after. There's a little bit of a debate about that, but just doing basic exercises, there's something called the alphabet. You're taking the big toe, and you're actually, I'll show you with my hand since I can't really do it with the foot, but you're actually spelling the alphabet. So I'm making a capital A, or I'm making a C, and you go through A through Z, and it actually will help strengthen the ligaments and tendons around the ankle. You do that a couple times a day. There's figure eights that you could do in different exercises that once you go see a podiatrist, they could give you some exercises to do.
Okay, great. Well, that's a handy tip. Thanks for tuning in tonight. Next month, we'll be talking in more detail about the walking campaign, and we'll be hopefully giving out some more pedometers. Thanks for tuning in to Feet Forward. If you have any questions or if you need a podiatrist in Chicago, visit the IPMA website at ipma.net and click on Find a Physician. Thanks. We'll see you next month.